Male patient fell from a bicycle and is unresponsive.
Okay. Good evening. I'm Hassan Richie, EMT at the Negril Fire Station. PSI. Is my scene safe?
Your scene is safe.
Okay, scene is safe. Alright. How many patients do I have?
One patient.
One patient. I'm going to consider ALS support. Also, I'm going to consider spinal immobilization. My general impression of this patient is a African American male, lying supine, unconscious. Right? I'm going to approach a patient in the line of sight. Sir, you can hear me? Don't move your head. At this point, I'm going to ask my colleague to manually stabilize the head. Spine. As he's doing that, I'm going to ask him to manually open the area using the jaw thrust maneuver. After he does that, I'm going to assess the area. Breathing. There's breathing, there's adequate rise and fall of the chest. Right. At this point, I'm going to auscultate patient's lungs, apex, and the base, lungs. All clear. I'm going to apply my pulse oximeter so you can get a pulse reading and an O2 sat reading. Okay, patient O2 sat is 95. I'm going to give my patient some oxygen by a non-rebreather mask at 12 liters per minute. Oxygen applied, non-rebreather mask. I'm going to check skin condition, skin temperature. Also check pulse, radial pulse for 30 seconds. Times 2. Pulse strong and bounding. At this point, I'm going to do a rapid scan. I'm going to make my transport decision at this time. It's a priority 1 patient, it's a load and go patient. I'm going to do rapid scan now using the BTLS as my guide, which is deformity, contusion, abrasion. Checking the head for crepitus, blood. Checking the ears for any cerebrospinal fluid, blood. Checking the eyes, mucous membrane. Checking the nose and mouth. If there is anything blocking or mucus in the mouth, going to check the neck. Check for tracheal deviation. Okay. I'm going to check the shoulder, clavicle, palpate. Going to expose, check the chest. all 8. And then I'm going to check the rib cage, check the abdomen now, 4 quadrants. And I'm going to check the hip, crepitus, non-found. Going down to the lower extremity, checking the leg, then expose, decap BTRS, remove the shoes, check the pulse, going to the other leg, when I expose, I realize that there's a bulge on here on the thigh. I'm going to use a sterile gauze to apply direct pressure to it, stop the bleeding, and bandage. Bleeding has stopped. Check rest of the leg. Decap BTRS, pulse. Check capillary refill. Refill in 2 seconds. And go to the upper extremity. Palpate the arm. Checking for decap BTRS. Checking cap refill as well. Alright. So at this time I'm going to apply my C color. Color applied. Alright, so at this time I'm going to log roll my patient onto the backboard. I'm going to ask my other colleague to assist me in log rolling the patient onto the backboard. While I roll my patient, I'm going to check the back, decap BTLS, check the spine, check the buttocks, back of the leg. Thing. Alright, so let's go down. Down and back forward.
And two.
Down and up.
1, 2.
Up.
1, 2.
So at this time, we're going to do a set of baseline vital signs, which will include temperature, checking the temperature, blood pressure, pulse, applying a pulse oximeter, checking the pulse bilaterally, 30 seconds, multiplied by 2. And check temperature. Right. Temperature is 36.4. Check Checking the blood pressure. Patient's blood pressure is 120/80. Right. So at this point, I'm going to load my patient in the ambulance, and his brother is here with him. I will ask him a set of baseline sample history. His brother is saying that he's not taking any medication, he doesn't have any illness. His last oral intake was about 12 o'clock today. And the event leading up to this was he was riding his bicycle. Alright, so en route to the hospital. I'm going to reassess vital signs every 5 minutes en route. When I reach the hospital, handing over, I'll tell the nurse, the condition I found him in, my intervention, and yeah, that's it.